behind what was being done. Our next speaker.
I'm sorry. I brought a few little veggie plants. Things to try them free of charge. End of the meeting, come on out. I've got a few things off the back of the tailgate out there. Go home with a little something. Thank you. Sorry.
It's okay. All right. Our next speaker, Rob, I'm going to let you introduce because I haven't met the lady except right now. And I do know that quite a few of you are here because of her. My wife was very angry that she not babysitter, and thank you for filming this because I got a lot of folks calling and saying, gee, I hope he's there. So,
this is Dr. Donna Becker, and she's moved locations.
Yes, Dr. Northwest Monitor.
Okay. What are you doing?
I'm board certified in medicine. I'm not recognized by any American board specialties. You see, like ER medicine in the late 60s, anyone who would work in the ER in the early 70s, you know, you were an OBN or work a few shifts in the ER room. But now we know that, you know, emergency room, it's the emergency department, and you have to be board certified to work there. So it's similar to that now in anti-aging, where many doctors say, well, yeah, I write anti-aging, sure, I can do bioidentical hormones, but they haven't done any courses, they haven't really studied it. So, you know, so that's kind of where it is. Well, I have studied it, I have passed written and oral boards, but again, it is not a recognized specialty, but I am board certified in ER medicine. So what I do is I like to think of it as hormone restoration. Mm-hmm. Of course, even as our speaker said at the beginning, hormones and all medical advice has to be filtered through your doctor, et cetera, and not everyone is a candidate for hormone medications, and not everyone I see is prescribed that. It depends on, you know, your history, your family history, what's going on with you, and so on and so forth. But what I do, which is unique, is that I draw the hormone levels. You see, our hormones do decline as we age, and what I do is I bring those levels up to what they were when you were 35 or so, about the first week after your cycle stopped, before estrogen, you know, increased to thinking that you were going to get pregnant this month, and before it fell off thinking, well, it didn't happen, you know, let's end the cycle. So before all those up and downs, I keep everything in a balanced, low ratio for you, and we do that through the hormone levels. And the bioidentical hormones, all that really means, by the way, is that the hormone is exactly a copy of what you made inside of yourself. And interestingly, as the last speaker was talking about gardening and so on, I was thinking that all the hormones come from the Mexican yam, interestingly enough. So that is contrasted to the synthetic hormones, which, for example, the Premarin is the brand name, comes from the pregnant mare's urine. You know, they keep a horse pregnant and tethered in a little stall, and then they take its urine and concentrate it and so on. And it's a dreadful affair, really, for the horse and so on. So the horse-derived urine is, the horse-derived urine's estrogen is used for women, but I don't use that kind. So we use the kind, the molecule looks exactly like the hormone that you made inside of your body when you were making hormones. And I also see men, and similarly, men's hormones decline as they age. They are rather luckier than we are in that they decline more gradually, generally speaking, but change. You know, men's hormones do decline more rapidly, and again, we measure the hormone levels, and if it's indicated for that individual, a hormone prescription is written and follow-up labs are done. That's what guidelines. Not every man is a candidate for hormone restoration either. So I just have a short little slideshow about hormone restoration and replacement what you do. But for a lot of people, when our hormones decline, or women, as to say, your life just changes completely. Some people have very, at that time of their life, they can't think, they can't work, and hot flashes, and so on and so forth. Many women, however, have very few symptoms. So again, it depends on your symptoms, what is going on with you, whether or not you're a candidate for hormone replacement. So,
can we put the table up so that maybe get in a row? Sure.
And there's some thoughts that perhaps if our hormones didn't decline, that aging could be put on hold. You know, without as we lose 10% collagen from our skin per year. and the overall deterioration of the body that comes with growing old is not inevitable. We now realize that some aspects of it can be prevented or reversed. But there are hormone changes, and not all decline. Estrogen may begin to decline 15 to 20 years prior to menopause, just with perimenopause. And then, of course, there's the andropause for men. But the human growth hormone, which has been somewhat demonized by the federal government, but it is, of course, illegal to be prescribed for anti-aging purposes. It is illegal now to be prescribed only in very restricted cases. But other important hormones which decrease with aging, DHEA is an adrenal hormone, and pregnenolone, a hormone precursor. I think you have pregnenolone here, I think, Robin. Pregnenolone is, along with DHEA, sort of a pro-hormone. It does decline as we age, and it's sold over the counter. Melatonin secreted by the pineal gland declines as well, and it helps in aid sleep. And the thyroid is just another gland that may decline along with the perimenopause period. This is a picture of the Gobi Desert, I believe. This is menopause, dry, hot, and so on. The symptoms of menopause, we all know those. The hot stomach, irritability, lack of estrogen causes very severe problems in the skin and the vagina, the brain, and so on. Hormones are waxing, waning, temperature dysregulation, that's hot and cold, depression, and so on. And we have a need to regulate the amount of estrogen that the ovary is producing. That's in the perimenopause period. Progesterone is the first to decline, and cycles can shorten or become more frequent. And sometimes progesterone cream or progesterone tablet at this time period in the young perimenopausal individual before periods actually stop. The hormone levels may vary, but within a range, depending upon the days of a woman's cycle. And, you know, we can certainly check those levels and find out what your unique needs are in the hormone. Menopause and andropause can be deficiency syndromes. And lack of collagen, as I discussed earlier, and depression, cardiovascular disease, and temperature instability. Women have far more heart disease after menopause than before. And testosterone lack can be anxiety and weakness. Interestingly, one of the first signs that a man has with decreasing testosterone is, interestingly, sort of an inability to make a decision. You know, a lot of anxiety. Shall I do this? Shall I do worry? You know, the testosterone gives a lot of focus, drive, and so on. And, you know, of course, there are options to replace or not. You know, there are some things that you can do that will help, not necessarily hormonal. You know those things probably as well as I do. Keep your weight down, monitor your sugar intake, a regular exercise, and so on. There are bioidentical hormones, and there are other hormone-like medications that one can take also, depending on if you have contraindication to hormone replacement. And soy, herbs, and exercise. There are certain vitamins and estrogen-like herbs like soy that can be very beneficial. But the bioidentical hormones, there are three types of estrogen. There's the estradiol, and it is the most powerful of all the female hormones, and it can be given as a pill, cream, or pellet. And then testosterone, of course, is very necessary for us as it is for men, not nearly in that amount, of course. And progesterone is also very important. It's the great calmer and helps you to relax. It's a mild diuretic. And then there are other medications that one can take also that helps with the loss of bone. They don't usually help very much, however, with the symptoms of menopause, the hot flashes and so on. So soy and herbs are other possible alternatives. And there are some things that you have here. I think I mentioned some of those brands. So we all need to be taking our calcium and our magnesium. The new most important supplement, of course, for our bones and also for our immune system is vitamin D. We don't get nearly enough vitamin D, and I've been measuring that in people, and it's very, very low. I must say, my own level of D, look at me, I'm very white. It was very, very low, and that's very important to have enough D.